My name is Patrick Tonnard. I'm from Ghent, Belgium, and I practice plastic surgery together with my associate, Alex Verpalen. We are working together since the 90s, so we cooperate. We have a private practice mainly specialized in facial aesthetic surgery, facial rejuvenation surgery. And historically, we developed the nanofat. Originally, we were the developers of the Max Lift, the short scar vertical vector facelift, which we published and we wrote books about it. But then in 2013 came the nanofat with the emulsified microfat, and we worked together with the Tulip company to have the instrumentation on the market. And that's how we came here. Because we are developing new techniques like max lift and so on, we follow the novelties in our specialty quite closely. We traveled a lot, and we came in contact with Sid Coleman. I think if you talk about fat grafting, you have to talk about Sid Coleman, who developed the lipostructure, lipofilling technique. Actually, he popularized and standardized the method of harvesting and injecting fat. And based on his experience, we modified a few things, especially to use fat in the face, which is mainly using microfat, smaller fat particles. And then the next step is that everybody saw that after fat injection in the face, you saw on the long term an improvement in quality of the skin. And so we kind of evolved and then wondered how, if we could have that fat closer to the skin with very fine needles, perhaps we could just have that improvement in quality, not the volumetric effect of the fat. And that's why we decided to emulsify the fat, squeezing the fat from an empty to a full syringe, which in the beginning people had to laugh a little bit with us because they say, yeah, they're just destroying the fat. But clinically, we had quite remarkable results with this technique. And that is then we went to the university and tried to figure out what happened on the cellular level. And then we discovered that actually we were destroying adipocytes, the fat cells, but not destroying the smaller cells of the stromal vascular fraction. And that is how the idea came that it is all managed by stem cells. Now, we originally thought that was the explanation for that, but apparently that was a little bit too simplistic. And nowadays, we are more thinking in terms of molecules that are secreted, the secretome of the cell, and that are responsible for intercellular communication. We're more thinking in terms of exosomes and these to explain the regenerative effect of that. And that is a very intriguing part of new science coming out of this. And well, I'm just a clinician, I'm not a researcher, but I see that a lot of people are doing very interesting research on that. And it makes me very happy that we just discovered something and changed something clinically that many people now are figuring out how it really works. That's interesting. The idea is that in all anti-aging, it's a new way of thinking. You have to think more preventively than treating a disease. So the idea is not to wait till you're diseased, but do a treatment preventive and then try to expand the disease-free interval and make you a longer time in a healthier period. That's the idea. That's the real anti-aging, is not working on diseased tissue. So we don't have to wait till the joint is completely destroyed, then you need a knee prosthesis or a hip prosthesis. But if your joint is like 5 or 10% malfunctioning, that's the time for a regenerative treatment. And I think this is the future, is treating your own, you're trying to be in an absolute healthy condition, and the side effect is that you will live longer and healthier. These are also people who live healthy, who do a lot of physical exercise, who want to be healthy. So there is a lot of things involved in that. It's not only taking a pill. Lifestyle choices is the one and only most important decision that you can do to live healthier. And if you would say diet, sleep, and exercise, this is for me the absolute most important, much more important than taking whatever pill to start with. People who are taking supplements most of the time are living healthy also. Well, I see that the interest is, it goes slow because we are doing this already 10 years and still some people are not interested in it. But it's also something, it's the skin that we're talking about, and it looks like this is dermatology, this is not plastic surgery. So a facelift where you correct the sagging, and even if you add volume, the deflation, but you don't do anything to the quality of the skin, it's like something missing. If you have an accident and go to the garage, it's like taking out the dent without doing the painting. It's half work. So if you want a new car, you do the complete thing. So it's something that the attention for the quality of the skin, it's not only eradicating wrinkles, it's also the pigmentation, it's everything. It's healthy skin. And if you don't incorporate this into your rejuvenation process, this is different. And actually, the difference between rejuvenation and regeneration is that with rejuvenation, we put the clock back. That's it. And then we say your result will last so many years, but you will continue to age. Now the idea is that we will try to make that clock tick slower, and if possible, stop the clock from ticking. And this is possible. And if you follow the literature, generally on anti-aging, there are enormously interesting things that are going to happen in the next 10 years. And as I mentioned in my talk, the evolution of technology is an exponential process, so that means it goes all the time quicker. So we think, well, perhaps in 50 years, no, it will be in 10 or 20 years that things will dramatically change. And something will happen like, it's like the internet, nobody asked for it. It just was there at a certain moment. 10 years later, nobody can imagine his life without the internet. So this will also happen in the process of anti-aging, I think.